Hi, everyone, and welcome for joining us for this weight management lecture on the role of metabolic medicine and weight loss medication. So I am here today with Dr. Garibe, and we are going to be talking all about weight management for breast cancer survivors and some of the medical interventions that can be utilized. So Dr. Garibe, thank you so much for joining us today.
Thank you, Jessica. I'm very excited about being here today. And our topic today would be about weight management for patients with history of breast cancer. I don't do the slides show. It's showing my slides on your end.
Yeah, I can see your slides.
So before we talk about breast cancer, I would like to talk about the definition of obesity. So obesity is defined as a chronic, relapsing, remitting, multifactorial disease that has neurobehavioral component to it, and it has also multiple complications. Some complications are metabolic, so that can result in increased risk of heart disease, high blood pressure, fatty liver disease, but also some complications are mechanical. So the excess body fat can result in acid reflux, obstructive sleep apnea, and many psychosocial aspects are related to the disease. And this is something where the disease of obesity intersects with breast cancer in a way. So before we talk about the management of obesity, I would like to talk about the prevalence of obesity as well. So this slide projects the prevalence of obesity in the United States, and this is a heat map. So the darker the color, the higher the prevalence of obesity. And as you can see, the prevalence of obesity is much higher in the South. And then watch what happens in the next 10 years. Obviously, more and more states with higher prevalence of obesity is seen, and then now in 2022. And if anything, this reminds us with the prevalence of obesity, but also reminds us with the COVID pandemic as well, where you start seeing a pattern in certain areas, and then that pattern disseminates across. So actually, we're not just dealing with an epidemic of obesity, we're dealing with a pandemic of obesity. But unfortunately, we don't have as many resources channeled to address this concern about the pandemic of obesity. And I'm very honored. I'm very glad we have this educational activity here to talk about obesity as a disease, because this is a very important topic to talk about. But also, it's not about the medications for weight loss or the lifestyle interventions only, but this is a public health issue that needs to be addressed from different angles and by different entities, and education is paramount. So the impact of obesity on breast cancer, obesity increases the risk of recurrence, and actually obesity has been linked to worse outcomes. It's one of the few things that the patient from a lifestyle standpoint can address or tackle is actually obesity. It can affect the treatment efficacy as well. As you know, many of the treatment options for management of obesity, they try to block the effect of estrogen. And so if we obviously lose weight, that in other terms, lose fat. Fat is one of the hormonally active organs that actually make estrogen. So from that angle, obviously, weight loss can help with reduction of the prevalence of obesity. Also, obesity is a pro-inflammation disease or pro-inflammatory disease. And as you know, for the development of cancer, for cancer to happen, it's mediated by markers of inflammation. And there are, as I mentioned, the psychosocial factors associated with obesity and cancer, especially breast cancer. It's not like other cancers where there's a very significant psychosocial aspect to cancer as a disease. but that cross-reacts with obesity as a disease as well. So benefits of weight management on breast cancer outcomes. There are multiple studies documenting improved treatment outcomes, reduced risk of recurrence, enhanced quality of life, and obviously better management of comorbidities related to cancer care, such as diabetes and high blood pressure. So the challenges in weight management in patients who have breast cancer, obviously the quality of life challenges patients with breast cancer have. The reduced physical activity due to treatment, whether it's surgery, radiation, or even chemotherapy. Hormonal therapy and the side effects to hormonal therapy, and both quality of life, temperature regulation, but also the hormonal challenges from hormonal therapy that can result in insulin resistance, emotional distress, and changes in appetite from the treatment, and difficulty in sustaining lifestyle changes. But also, it's very important to mention that the management of breast cancer can also result in sarcopenia, in other terms, loss of muscle mass, and that can reduce the basal metabolic rate for patients with breast cancer, especially those with obesity. So there are, from like evidence-based strategy standpoint, nutrition is paramount. Everyone expects when we talk about weight loss interventions, everyone expects that we'll talk about the medications. Medications mean nothing, would do nothing, have no efficacy or effectiveness in treating obesity if we don't pair that with lifestyle interventions. And these are nutritional and physical aspect to the lifestyle intervention. So nutritional aspects are focusing on plant-based diets, low glycemic foods, having adequate protein intake to make sure we don't lose as much muscle mass, and also at the same time physical activity. And here I'm saying physical activity, not exercise, because we don't expect all of our patients to necessarily exercise. And when we talk about these interventions, we're talking about a lifestyle intervention, not a diet. And so this is very important. So lifestyle is all about having a gradual intervention. It has to be slow. It has to be strategic. It's more optimistic. It's more rewarding versus diets. All diets fail because they're more punitive and they're more reactive. They're more emotional and they're goal-oriented versus lifestyle, which is very process-oriented. And so, and also behavioral therapy. So cognitive behavioral techniques, support groups, counseling. Patients have to understand that this is could be a mental disease, and there is a neurobehavioral component to the disease, as I mentioned. Also, part of the lifestyle, it's not just the physical activity and the exercise, but also the sleep. So having a good quality of sleep, but also the quantity of sleep, how many hours we sleep, is very important. And it's interesting because the studies have shown that we need to basically, when we try to lose the weight, if we sleep less, that can result in weight gain, but also if you sleep more than 9 hours, for example, that has been linked to higher prevalence of weight gain. So when it comes to medications, and when we pair medications with weight loss interventions and lifestyle interventions, patients have to be aware that this is a chronic disease. So for a chronic disease, you expect to take the medication for long term. So you have to be open to taking medications for weight loss long term. And the success is defined by losing 5 to 10% of the total body weight. And patients come to the clinic and they think that the goal is to have a quote unquote normal BMI. That's not necessarily the case. The rate of weight loss should not be rapid. Otherwise, we will be having a higher risk of running the risk of having loss of muscle mass. And we have to also know that many times we have been using medications off-label for weight loss. And part of the reason why there are so many administrative challenges related to prescribing the medications and the affordability of the medications is a big challenge. And the most important thing is close follow-up is needed, whether you're seeing your primary care physician or your metabolic medicine team or your nutritionist. Having close follow-up is important, not because we do magic, we don't, but what we do is we try and make sure that you adhere to the lifestyle interventions and the goals you have set for yourself, and make sure that even if you fall or fail, you're falling forward. And an important message also to remember is, based on your goals for transforming or improving your chronic diseases related to the weight problem, you have to take into consideration that just losing 5 to 10% would help quite a bit. If you have, or if the patient has a component of fatty liver disease, we try to encourage them to lose a little bit more than 10 to 15% because more drastic weight loss is needed to achieve that. So the commonly used medications for weight loss, as you guys know, there are different molecules or medications. The first one was Ozempic, which was FDA approved for management of diabetes. And then this same molecule, which is called semaglutide, was packaged in a different form called Wegovy. And these medications work on both the hypothalamus, which is the base of the brain, but also on the gastrointestinal system. They slow down the transit of food from the stomach to the intestine, which facilitates more or better feeling of satiety and makes the patient feel full easily. And that's part of the reason why these medications also have, or commonly can cause, a lot of gastrointestinal side effects. Same thing for the other medication, which is called Mounjaro, which was FDA approved for management of diabetes. Same exact molecule has been also approved for management of obesity and is packaged as Zepbound. And usually we start with a small or low dose and then slowly or gradually increase the dose based on patient's tolerance and how fast weight loss is happening. It's also important to mention that we have been using metformin to facilitate weight loss. Commonly, patients with breast cancer have or take antipsychotic medications or antidepressants, which can also cause weight gain. And also patients who have breast cancer and prediabetes may benefit from taking metformin. Also, metformin can cause a lot of gastrointestinal side effects, and that's why we typically use extended release form of the medication to help with blocking the weight gain from the medications used for depression, but also reduce the risk of prediabetes. And usually the titration of these medications is gradual. The role of healthcare providers, the role of your team is to work together. So early identification of high-risk patients is needed. Having a personalized weight management approach is essential. And we have to know that weight loss or managing obesity is never one size fits all. So based on the medical problems you have, the complications you have, you may need to be seen by a dietitian or maybe a physical therapist or maybe a psychologist, or a more comprehensive approach using a metabolic team. And it's important to remember that, with the recent advancement in the weight loss medications, we sometimes forget about weight loss surgery, but weight loss surgery is one of the most effective interventions for management of obesity. And that's why in our program, actually, we use a team-based approach, and we have integration between the medical and surgical weight management, which is something we take pride of. And the other important piece is patient education and support. So educating patients about weight issues and cancer outcomes is very, very important. We have to have clear, actionable guidance from the oncology team, and utilizing digital tools is becoming more of kind of an intervention that we can use for patients, using actually AI-powered platforms and apps to help patients stay on track and also stay motivated has been also a relatively recent intervention, which sounds to be a very promising approach. So whenever we set goals for our patients, we use this kind of blueprint, which uses the SMART goals. So they have to be specific. We need measurable interventions. They have to be attainable interventions, and they have to be relevant to the patient. And the most important thing, it has to be time-based. So for example, we try to give the patient specific goals about how many steps they have to walk and how many calories they should consume. We encourage patients to use tools, for example, smart watches and devices. Even using your smartphone to track your physical activity is important. I always tell patients you cannot manage what you don't measure. So having a measurable goals is very important, but then obviously the goals have to be something you can achieve, and they have to be relevant to your struggles and challenges, and then close follow-up is needed. And so we set timeline for patients, and everyone's timeline would be different based on their goals and their challenges with their health. It's important to remember when we talk about weight management that we go through cycles. Your mindset is not always the same. So sometimes you are super motivated and sometimes you're not as motivated. If we're talking about any chronic disease, sometimes you are losing the weight, maintaining the weight, or maybe gaining the weight. So don't be frustrated. This is a journey. This is a marathon, not a sprint. Embrace this as a journey, and you will basically, as long as you believe in the process, you will get there. And if you feel that this is kind of a rabbit hole, if you feel like this is very complicated, yes, it is. And hopefully the goal of your team is to make sure that you stay in the action phase, stay motivated, activated, engaged in your treatment plan. But if not, take it easy on yourself and wait, give it some time, because this is a chronic disease. It doesn't disappear overnight. So in summary, weight management is essential for improving outcomes in patients with breast cancer. Addressing the challenges with a multidisciplinary approach is needed. This is a lifestyle. This is not a diet. Medications don't do any magic. It's all about staying motivated, taking your lifestyle, your health to the next level is essential. This is about control. This is about you controlling your lifestyle, and not having your health challenges controlling you. With that, thank you for inviting me, and we'll see if Jessica has any questions for us. Thank you.
Great. Thank you so much for joining us today. In the interest of time, I have one big question I wanted to ask you. I love what you shared about taking a lifestyle approach and focusing on gradual weight loss as opposed to like quick, fast results. I think that that's so meaningful. So thank you for stressing that. I think that's something that needs to be shared. So thank you for reinforcing that. One question I know a lot of people listening had that they shared with me when we were, announcing this was they wanted to know, okay, so if someone is interested in exploring medically assisted weight loss options or taking an approach that encompasses, a team approach, where would you recommend that they start?
So start with the team that you trust the most. This is very important because this is a journey. And for that journey, you want to make sure that the person, the provider, the dietitian, the physical therapist, maybe the oncologist, understands that this is a chronic disease, and make sure that you start by acknowledging actually that this is a chronic disease. So this is, as I mentioned, it's a long journey. So you start with yourself, actually. Treat yourself with kindness. Take it easy on yourself. Take your time. Try to understand. Try to reflect. And then after that, you basically start with lifestyle. You start with the nutrition. Again, the medications are just a tool. They will help you achieve the goal, but making sure that the lifestyle is the cornerstone intervention is very, very important. It's essential. Sometimes I make it a point and try not to prescribe the medication from the first visit, because patients come for the weight loss medication, for the Ozempic, for the injectable medication, and it's not the secret. The secret is from within. It's actually not from the nutrition. It's from the mindset. Whether you believe that you can lose the weight or not, you are right. So this is something I always tell patients about. It comes from within. It needs patience. It's a marathon, not a sprint.
Thank you so much for sharing that. We're so grateful that you took the time to be with us today and to share your insight and your expertise. So thank you so much. And for all of you watching this, thank you for joining us. We hope that you found this presentation helpful. And please feel free to check out any of the other videos in the series. They are created to provide a comprehensive approach to weight management for breast cancer survivors. So thank you so much for being here.
Thank you, Jessica.